So just to summarise the situation in Australia at the moment, make a couple of brief comments about what's the same, what's different compared with last year, and also to put it in context with the rest of the world. So firstly, as of today, with today's figures that were announced by all jurisdictions and collated at the Commonwealth level, as we do each day at around midday, we can see that we're now up to 38,165 cases since the beginning of last year, and sadly 948 deaths. In this year, we've seen we're closing in on 10,000 cases now for the whole country, and sadly 39 deaths. Most of those cases and most of those deaths have been associated with the New South Wales outbreak, which is continuing to be a concern, particularly in Sydney, but also in other areas of the state. What do we know about this outbreak? This is clearly our third wave in Australia. The first wave, you'll remember, right back in the beginning of the pandemic, was mostly related to people coming from overseas, so overseas acquired cases and some local cases. Almost exactly at this time last year, we were faced with the terrible situation in Victoria and that wave, which was mostly locally acquired cases in Melbourne. And now we're in this wave, which is not entirely, but mostly in New South Wales. In fact, we have active outbreaks at the moment in 4 of our 8 jurisdictions. In order of concern, I would say in Queensland, they are still seeing some cases related to the outbreak in southeast Queensland, but that is definitely under control. Most of those cases, in fact, almost all of them, are in quarantine for their entire infectious period, and that is not a concern at the moment. Continue to be watched. In Victoria, of course, Melbourne is still in a lockdown phase in relation to that latest outbreak in Victoria, but again, almost all of the cases that are being diagnosed are already in quarantine during their infectious period. So again, that is coming under control. In the ACT, we have very few cases at the moment, but this is the first time in the ACT we've had locally acquired cases for more than a year, and this is new to the ACT. We're continuing to give support to them, and they're learning, of course, and being given support from all the other jurisdictions that have been in this situation. A complex group of exposure sites, and that will play out in the next few days. I'd just like to give a shout out to all people in the ACT that are experiencing lockdown right now, particularly those thousands of people that are lining up to get their tests as they've been asked to do so. And then finally to New South Wales, we continue to see large numbers of cases, increasing numbers of people in hospital, and some spread through the state, including to some regional areas, and these are the main areas that we're assisting New South Wales with at the moment. Just go to the next slide now. This is looking at hospitalisation, including ICU, of course, in hospitals. The blue line is representing 2020, and the orange line this year. So in 2020, we had those 2 waves again of cases that we saw in the previous graph. This is related to hospitalisations. Quite a large peak in hospitalisations at the beginning of last year, a larger peak in relation to the Victorian wave at almost exactly the same time a year ago. Contrast that to what we've seen throughout the whole of 2021 until very recently, very few people in hospital, and now that number mostly in New South Wales, which is following a very similar trajectory to the situation in Victoria last year. Just go to the next slide, please. The contrast, and this is a really important point, and absolutely goes to why we are asking people to get vaccinated. Vaccination is protecting Australians. We saw last year, and people will remember those the hospitalised people, a lot of them, most of them in fact, in aged care, coming from aged care settings, residential aged care. Because of the success of the aged care rollout in terms of vaccination, that terrible death rate that we saw last year is not being replicated this year at the moment in terms of deaths. That is mostly because our oldest population, including those in aged care, are largely protected by vaccination. It's a very important point. Just go to the next slide, please. This is another way of looking at that same issue. So just to quickly explain the bars here, the larger bars are related to Victoria last year. The smaller ones is this year, the current outbreak in New South Wales. The red colour at the top is deaths. Then intensive care is the yellow, there's a smaller ICU you might not be able to see there on that bar. The yellow is hospitalised, and the blue is non-severe, non-hospitalised cases. So, of course, many more cases last year compared with this year. That hospitalisation rate in relation to all ages on this side and the less than 60 on this slide. Sorry, just go back. So in terms of that, it again demonstrates the protective effect of vaccination in that older age group. The people aged less than 60, we're still seeing some severe cases, mostly not. But in terms of last year versus this year, a big difference in terms of that over 60 age group, much lower death rate and lower ICU rate. I just wanted to spend the next two slides actually talk to the international situation. Last night I was privileged to talk to with our chief scientist, Dr. Foley. Professor Foley and myself spoke to our counterparts in the UK and just contrasting and comparing what they're finding in terms of their vaccination rollout and their waves that they've seen in terms of cases, hospitalisations and deaths. In the UK, we know they have a very high rate of vaccination, particularly in the older age groups, but throughout, almost 70% vaccination rate, our target for moving to phase B here in Australia. In their older age groups, over 90% of vaccination coverage in their over 70s, and that's, of course, what we're also aspiring to. What they found is they've had their fifth wave really in the UK, and that's similar to most of the rest of the world. About a month ago, they started to really increase those numbers of cases. But if you look at the orange line here, in contrast to previous waves, their death rate has remained extremely low. That's similar with hospitalisation. It's similar with ICU. They have seen some pockets where vaccination locally has been lower than the rest of the country, and that's where they have seen hospitals and ICU rates increase. But that death rate has remained extremely low. This is what we're aiming for here in Australia. Just go to the next slide, please. Just another example closer to in our region. So this is Singapore. They've been very successful. Most of the time they had those waves related to their migrant hostels late in the middle of last year. They've had a subsequent wave recently. Again, very high vaccination rate right throughout their population of over 70%. Death rate has remained very low despite the increase in the case numbers.